Hi everyone, welcome back. In this video, we'll be discussing some key CBT questions and how they are applied in practice. So, question number 31 is you have noticed that the management wants all residents to be up and about by 8:30 am so they can be ready for breakfast. Mrs. X has refused to get up at 8 am and she wants to have a bit of lie-in, but one of the carer instead was and dress her and took her the dining room. What type of abuse is in place? Financial abuse, psychological abuse, sexual abuse, institutional abuse. So, this is the type of institutional abuse because institutional abuse occur when practice or policies in a care setting prioritize routine over individual right, autonomy, or preferences. So for question number 32, patient asking for Lama, the medical team has concern about the mental capacity of the patient. What decision should be made? Option A, call the police. Option B, call the security. Option C, let the patient go. D, encourage the patient to wait by telling the need of treatment. So option D is the correct answer. If there are doubt about the patient mental capacity, it is essential to encourage them to wait while assessing their understanding of the consequences of their decision. So for now, question number 33, you are a registered nurse in a community giving health education to a patient and you notice that a student nurse is using his cell phone to text. What should you do? Option A, tell the student to leave the emphasize what disappointment is. Option B, report the student to his instructor after duty. Option C, politely signal the student and encourage him by actively including him in the discussion. So option 3, best option is option C, politely signal the student and encourage him by actively including him in the discussion. Because addressing the situation politely and engaging the student is a professional way to redirect attention without embarrassment or confrontation. So for the question number 34, a person supervising or nursing a student in the clinical area is called option A, mentor. Option B, preceptor. Option C, interceptor. Option D, supervisor. So for 34, it is the mentor. Training of a student nurse is responsible of option A, ward in charge. Option B, senior nurses. Option C, team leaders. Option D, all RNs. So for 35, option D is the correct answer. So for the question number 36, you can delegate medication administration to a student if option A, the student was assessed as competent. Option B, only under close direct supervision. Option C, the patient has only oral medication. Option D, the student is there of final year training. For question number 36, option B, only under close direct supervision is the correct answer because medication administration must be supervised to ensure safety as the student nurse is still learning and practicing under the IN's guidance. So option B is the correct answer. Question number 37. A community health nurse with second year nursing student is collecting history in home. The nurse noticed that a student is not at all interested in what is doing around C is starting on her phone. Ideal response. Option A, ask the student to leave the group. Option B, warn her in public that such behavior are not accepted. Option C, inform the principal. Option D, talk to her in private and make her aware that such behavior could actually belittle the profession. So for question number 37, the correct answer is the option D. Because addressing the issue privately maintains professionalism and gives the student an opportunity to reflect and improve. So for the question number 38, in supervising a student nurse program performing a drug around the NMC, expect you to do the following at all times: supervise the entire procedure and signal sign the chart. Option B, allow the student to give drugs sign and chart at the end of the shift. Option C, delegate the supervision of the student to a senior nursing assistant and ask for feedback. Option D, allow the student to observe but not signing the chart. So for the question number 38, option A is the correct answer. Supervise the entire procedure and sign the chart. Because the supervising nurse must oversee the entire drug administration process and ensure proper documentation. For the question number 39, a preceptor is working with a new nurse, and notes that the new nurse is reluctant to delegate tasks to member of care team. The nurse preceptor recognizes that the reluctance most likely is due to option A, role modeling behavior of the preceptor, B, the philosophy of the new nurse school nursing, option C, the orientation provided to the new nurse, option D, lack of the trust in the team member. So for question number 39, the correct option is option number D, lack of trust in the team member, because reluctance to delegate often stem of concern about other competence or reliability, highlighting the need of build trust and teamwork. So question number 40 is, being a student observe the insertion of the an ICD in the clinical setting. This is a formal learning or informal learning. This is a informal learning, because observing a procedure in a clinical setting is a considered informal learning as it involves the practice experiencing without structure instruction. So if you like this video, you can subscribe to our channel. Thank you so much.